Ever wondered how a cat tooth implant works? Well, it's more common than you might think. Just like humans, our feline friends can suffer from dental issues that require more than just a quick cleaning. Sometimes due to disease, injury, or just plain old age, a cat may lose a tooth and require an implant. Cat tooth implants are a relatively new field in veterinary dentistry, but they're gaining traction as a viable solution for cats with missing teeth. The procedure involves surgically placing a titanium post into the cat's jawbone, which will eventually support a custom-made tooth. It's a complex procedure, but it can greatly improve a cat's quality of life. So why might a cat need a tooth implant? The reasons can vary from severe tooth decay to injury, or even certain breed-specific dental issues. But don't worry, we'll be covering all that and more in the upcoming segments. Stay tuned as we delve deeper into this fascinating procedure. You might be asking, why would a cat need a tooth implant? Well, just like humans, our feline friends can also face dental issues that require medical attention. One might not expect it, but tooth decay, injuries, and even genetic issues can lead to the need for a tooth implant in cats. Let's start with tooth decay. Cats, especially those on a diet high in carbohydrates or sugars, can fall victim to dental cavities and tooth decay. If left untreated, this can lead to painful infections and eventually the loss of the affected tooth. In such cases, a tooth implant can restore the cat's oral health and prevent further complications. Injuries are another common reason. Cats love to explore, and their adventurous nature can sometimes lead to accidents. A fall from a height, a fight with another animal, or even a simple misstep while playing can result in a broken or cracked tooth. When a tooth is damaged beyond repair, vets often recommend an implant to replace the lost tooth and maintain the cat's ability to eat and groom. Genetic issues can also play a role. Certain breeds of cats, like the Persian and the Maine Coon, are more prone to dental problems due to their unique jaw structures. These breeds may suffer from misaligned teeth that can cause discomfort and difficulty in eating. In such cases, an implant can be a viable solution to help the cat lead a normal, pain-free life. So it's clear that tooth implants are not just a cosmetic procedure for cats. They play a vital role in maintaining the health and well-being of our furry friends. When a cat loses a tooth, it doesn't just lose a part of its smile, it can also lose its ability to chew food properly, which can lead to digestive issues and malnutrition. Not to mention, tooth loss can also affect a cat's grooming habits, which are vital for its overall health and hygiene. Now that we understand the reasons, let's explore how vets determine the need for an implant. How do vets determine if a cat needs a tooth implant? This question brings us to the third phase of our journey, diagnosing the need for a tooth implant. The process begins with a thorough physical examination. Your vet will meticulously inspect your cat's mouth, checking for signs of dental disease or damage. These signs might include bad breath, red or swollen gums, loose or missing teeth, or any changes in eating or chewing habits. The vet will also look for signs of pain, such as your cat pawing at its mouth or showing reluctance to open its mouth. But sometimes the problem isn't so obvious. That's where modern technology steps in. Dental X-rays are a common tool used to get a closer look at what's happening beneath the surface. An X-ray can reveal issues that aren't visible to the naked eye, such as tooth root infections, bone loss, or fractures. And in some cases, even X-rays aren't enough. If the situation is particularly complex, or the X-ray images are unclear, your vet may opt for a CT scan. CT scans provide a more detailed, three-dimensional view of your cat's mouth, allowing the vet to make a more accurate diagnosis. Regardless of the method, the goal is the same: to get a complete understanding of your cat's oral health. This is a critical step as it helps your vet determine the best course of action. If a tooth implant is recommended, it's because your vet believes it is the best option for your cat's health and quality of life. Remember, every cat is unique, and so is their oral health. What works for one cat might not work for another. That's why these diagnostic steps are so important. They allow your vet to tailor the treatment to your cat's specific needs, ensuring the best possible outcome. Once the need for an implant is confirmed, the next step is preparation for the procedure. But we'll delve into that in the next segment. For now, rest assured that your vet is equipped with the knowledge and tools to make the right decision for your furry friend. So what steps are taken to prepare for a cat tooth implant? Well, let's dive into the nitty-gritty of the preparation process. It's a multi-step journey, ensuring the best possible outcome for our feline friends. The first stop on this journey is cleaning the tooth area. Just like we humans need a clean slate for any dental work, cats are no different. A thorough cleaning of the tooth area is crucial to prevent any potential infections that could complicate the implant procedure. Next up, we might need to consider tooth extraction. Of course, this step is highly dependent on the condition of the existing tooth. If the tooth is damaged beyond repair, it's often necessary to remove it entirely before the implant can be placed. A veterinary dentist will assess the situation carefully to make the best decision for the cat's health and comfort. Now, this might sound a little intense, but remember, the goal here is to provide our feline companions with a pain-free, fully functional set of chompers. It's all about improving their quality of life. After the tooth area is prepped, the next stage is pre-surgical testing. This is an essential step in any surgical procedure, not just tooth implants. Pre-surgical testing typically includes a thorough physical examination and blood work to ensure the cat is healthy enough to undergo the procedure. These tests are crucial in identifying any potential risks or underlying health conditions that might affect anesthesia or surgery. The safety and well-being of our feline friends are always at the forefront, and these tests help ensure that the procedure goes smoothly with minimal risks. So, there you have it, the steps involved in preparing for a cat tooth implant. From cleaning the tooth area to potential tooth extraction and pre-surgical testing, it's a comprehensive process designed with one goal in mind: to ensure the procedure is as safe and successful as possible. With the cat prepped and ready, it's time for the main event. Now, let's walk through the actual implant procedure. The implant procedure is a meticulously planned process that begins with an assessment of your cat's oral health. The veterinary dental specialist will examine your cat's mouth, take x-rays, and determine the best course of action. The first step in the procedure itself is the administration of anesthesia. This is a critical component of the process because it ensures that your cat doesn't experience any pain or discomfort during the procedure. The anesthesia is carefully calibrated based on your cat's size, weight, and overall health status. It is administered under close supervision, and your cat's vital signs are monitored throughout the procedure to ensure its safety. Once the anesthesia takes effect, the dental specialist will then proceed with the implant placement. This involves creating a small hole in the jawbone where the missing tooth was. The implant, which is essentially a small titanium post, is then carefully inserted into this hole. The titanium post acts as a substitute for the root of the tooth, providing a strong and stable base for the new tooth. Following the placement of the implant, a healing cap is then placed over it. This cap helps to guide the healing of the gum tissue around the implant and also protects it. After the healing cap is in place, the surgical site is then stitched up and the procedure is complete. Throughout the entire procedure, the veterinary dental specialist plays a crucial role. They are responsible for not only performing the procedure, but also monitoring your cat's health and well-being throughout. They ensure that the procedure is as smooth as possible and that your cat is comfortable and safe. The dental implant procedure may sound complex, but it's important to remember that it's a routine procedure performed by skilled veterinary dental specialists. They have the knowledge, training, and experience to perform the procedure with precision and care, ensuring that your cat can go back to enjoying its meals and playtime without any pain or discomfort. It's also worth noting that while the procedure itself is relatively quick, the healing process takes a bit of time. The implant needs to fuse with the jawbone, a process known as osseointegration. This is what gives the implant its strength and stability. Typically, this process can take several weeks to a few months to complete. So there you have it, the implant procedure in a nutshell, a carefully orchestrated process that prioritizes your cat's comfort and safety and aims to restore its oral health and quality of life. The procedure is done, but what happens post-surgery? Post-surgery care is crucial for a successful cat tooth implant. After the procedure, the first thing to understand is that your feline friend might experience a bit of discomfort. It's a normal part of the healing process, and there are ways to manage this. Your vet might prescribe some pain medication. It's important to administer these exactly as instructed. Overdosing can lead to complications, and underdosing won't provide the relief your pet needs. Monitoring the implant site is another key aspect of post-surgery care. Keep an eye out for signs of infection, such as redness, swelling, or pus. Also, check if your cat is having trouble eating or seems to be in pain when they chew. These could be indications that the implant isn't settling properly. If you notice any of these signs, don't hesitate to contact your vet. Another factor to consider is your cat's diet. After surgery, their mouth will be sensitive. It's recommended to switch to soft, easy-to-chew food for a while. Avoid hard kibble, as it can cause discomfort and potentially damage the implant. As your cat recovers, you can gradually reintroduce their regular food. It's also important to maintain good oral hygiene. Regular brushing helps prevent plaque buildup around the implant, contributing to its longevity. However, be gentle around the surgery site, especially in the early days. Remember, every cat is unique, and so is their recovery process. Some might bounce back quicker than others, while some might need a little extra care and attention. Patience is key here. In the end, it's all about ensuring your cat's comfort and health. After all, they're not just pets, they're part of the family. The effort you put into their post-surgery care can greatly enhance their quality of life, making those purrs of contentment even more rewarding. And that, in essence, is how a cat tooth implant works. We've covered a lot of ground today, so let's summarize. We've journeyed through the intriguing world of cat tooth implants, a topic that not only sheds light on the advanced veterinary dentistry, but also underscores the lengths we are willing to go to ensure our furry friends lead healthy, happy lives. We started by introducing the concept of cat tooth implants. This might have seemed like a strange or even unnecessary topic to some, but as we delved deeper, it became clear that just like us, our feline companions can also suffer from dental issues. Whether it's due to age, injury, or disease, cats can lose their teeth, and when they do, it can severely affect their quality of life. From there, we ventured into the reasons why cats might need tooth implants. Tooth loss in cats can lead to a variety of problems, from difficulty eating to changes in behavior. Implants can help alleviate these issues, making them a worthwhile consideration for any cat owner dealing with a toothless kitty. We then discussed how a need for a tooth implant is diagnosed. It's not always as simple as spotting a missing tooth or two. Vets use a combination of physical examinations and X-rays to determine the extent of the damage and the best course of action. This part of the process is crucial, as it sets the stage for everything that follows. Next, we explored the preparation that goes into the procedure itself. It's not just about booking an appointment and showing up. There's pre-surgical testing, fasting, and even dental cleanings involved. It's a process that requires a fair bit of planning and preparation, but it's all in the best interest of our furry friends. Then we took a detailed look at the procedure itself. We learned that while it's a complex process, it's also one that's carried out with the utmost care and precision. With the help of anesthesia, vets carefully insert the implant into the cat's jawbone, ensuring that it's a perfect fit. Finally, we talked about the importance of post-surgery care and recovery. This is where the cat owner's role really comes into play. From administering medication to monitoring the cat's behavior and ensuring they're eating properly, it's a critical part of the process that can greatly influence the success of the implant. Through all these discussions, we've discovered that cat tooth implants are more than just a novelty. They're a testament to our commitment to our pets' well-being, our willingness to explore new ways of ensuring they live their best lives. And while they may not be necessary for every cat, for those that do need them, they can make a world of difference. Remember, a healthy cat is a happy cat, and sometimes that means getting a tooth implant. Until next time, keep those feline smiles bright.